This is Randy Wykoff, the Dean of the College of Public Health at East Tennessee State University. And I'm recording this on New Year's Eve, and I thought it would make sense to have a quick 5-minute review of the pandemic over the past year. So for a disease that was completely unknown before the last month or so of 2019, we have now seen 1.8, almost 2 million deaths worldwide, over 83 million documented cases and many more undocumented, and a 4.3% increase in the past week, telling us that it's still growing. Early in the pandemic, the cases were in China, then followed by a very large growth of deaths in Europe. Then the European deaths shown in green here really almost disappeared in the summer, thought to be replaced by deaths in the Americas. But then 7 months after the first wave, there was a massive second wave in Europe. And so today, if you look at the 40 most impacted countries in the world, and this is deaths per million, you can see that the ones shown in white on this next slide are in Europe. Pink is South America, yellow is elsewhere, and blue is North America. And you can see the US with over 1,000 deaths per million. That means 1 death for every 1,000 people in the country due to COVID-19. If you look at the most serious pandemics in recorded human history, in terms of total deaths, there's COVID-19 in the 17th spot. But with projected growth, it'll almost certainly get in the top 15 and perhaps even the top dozen. In terms of the United States, we've had 353,000 deaths. Cases and deaths have occurred all over the country. This is where all the cases have been cumulatively. And you can see scattered counties around the country, but with a clustering in Tennessee. In terms of deaths per million, you can see Tennessee at 997 deaths per million. And I do want to point out that it looks like many countries and many states are well past 1,000 deaths per million and going up close to 2,000. If we were to compare Tennessee to all the countries in the world, we would be in the top 10 of the most impacted countries in the world in terms of deaths per million. We know that these deaths predominantly occur in folks who are older, 65 and above, especially those with chronic diseases. But without a doubt, there are cases of situations where young, healthy people have died from COVID-19. If you look at the number of expected deaths in the United States, this was in 2018, but it's about the same today. COVID-19 would be in solid third place as the third leading cause of death in the United States over the past year. It's not just influenza. It's not just pneumonia. These are 350,000 deaths. The CDC has estimated well over 300,000 excess deaths in the United States in the past year. Cases have occurred everywhere. In the last 2 weeks, you can see a clustering of cases in the Southwest, across the Southwest, and also right here in Tennessee. If you look at our region, you can again see a high cluster of cases in the past couple of weeks. And in the Ballot Health Service area, their 21 county catchment area, over 1,000 deaths. The bottom line is, yes, there have been 2 vaccines approved. They're starting to be distributed, but distribution is going slowly, as would be expected. And even optimistically, if it goes well, we would not see a significant impact on the transmission of SARS-CoV-2 in our country, probably for a couple of months. And even after that, for some period of time, we would see imported cases from other countries. The pandemic continues to spread around the world, approaching 2 million deaths. The European countries were initially hit hardest, then they had a relatively slow growth, and now they're being hit again 7 to 8 months after the first wave. We're not sure what this means for the United States, but it is a cautionary tale for us to continue to be careful. The U.S. has now passed 1,000 deaths per million, with growth occurring in virtually all parts of the country, and expected to hit 400,000 deaths in less than a month. And Tennessee overall, and the Appalachian Highlands in particular, continue to be one of the most heavily impacted areas. So we are in the midst of a growing and evolving pandemic. We do not have a magic bullet yet until these vaccines are more widely available. So please avoid unnecessary crowds, wear masks, engage in social distance, maximize the distance you are from people and minimize the time. Good hygiene, of course, stay home if you're sick. We need to do a better job of contact tracing and quarantine and isolation. And obviously, we need to continue to protect the elderly and those with chronic conditions. And if we've learned anything in this past year, we need to treat each other with greater kindness and respect. This has been a long, difficult year. I appreciate everyone's interest in COVID-19. Please recognize it has not ended yet. We have to continue to be vigilant, continue to work together, continue to make a commitment. And remember, public health has two words in it, public and health. It needs the public to be involved. There's a great deal more information about COVID-19 on the College of Public Health website. If you know anyone who'd like to be added to the mailing list, please let Jan Stork know. As always, thanks to Dara Young for editing, producing, and posting this video. If you have any questions or comments, please let me know, and let me close the way I began by wishing you all a very happy New Year. I hope that 2021 is, and I hope it is your best year yet. Thank you very much.